You ready? Let's do this. Hello, everyone. Welcome back to the GROklahoma podcast. Today, we're honored to welcome an epidemiologist at Cherokee Nation Health Services, whose work has been at the forefront of community-engaged research, health disparities, and public health advocacy. With over a decade of experience, they have led critical research initiatives on tobacco-related disparities, cancer disparities, and infectious diseases affecting Native American populations. From their leadership in COVID-19 contact tracing to their pioneering role in NIH-funded projects, they have dedicated their career to closing the gaps in health inequities. Today, we'll talk about their work and their approach to community-based research, the unique challenges in AI, American Indian and Alaska Natives health, and what the recent $17 million NIH ICON grant means for the future of cancer care in Native communities. Please, everyone, join me in welcoming Dr. Ashley Comiford to the podcast.
Hello, thank you for having me.
Of course. And I guess, like we start on this podcast, can you share a little bit about you, especially your background, childhood, if you're able to share? And I always like to see that string, maybe some things that happened in your childhood that will have predicted your current path today.
Yeah, of course. So I grew up in Oklahoma. I was born and raised in Rogers County, in a little bitty town where I think I graduated with 34 high school students, a very tiny town. I was definitely a first generation college student, and I definitely knew I was going into some sort of science field. Always loved math and science. And so initially I really thought I was going to go to medical school. I think on my high school yearbook quote, I said I was going to cure cancer or something like that. So when I got into college, I chose a pathway that I thought would lead to medical school. So I ended up getting a bachelor's in microbiology. But after doing a lot of seminars related to health, I was a kind of a professional babysitter during college, and I babysat for quite a few physicians. It just didn't seem like the path I wanted to take. I had a lot of people saying it was worth it, and then others saying it wasn't worth it. And so I really kind of took a step back to say, is this really what I want to do? Do I want to go into the medical field? And so I kind of did a real deep research on health adjacent fields. And that's kind of what I stumbled into public health. And so after kind of analyzing public health careers, I was like, this is something that is health related, and I might even be able to make a bigger impact than just being a physician or in the healthcare field. And so I decided to get my master's and then later on a doctorate in public health. And, after my first epi course, I just knew this is what I wanted to do. It fascinated me. And ever since, I haven't looked back.
Wow. What a story. Thank you so much for sharing that. And I just chuckled when you talked about where you grew up and, your small class size. Because we've had a couple of guests on the podcast who speak about those experiences. And I'm just trying to make a guess here, because even though you didn't mention it, but I imagine it's implied, that you had maybe some mentors who probably helped you as well along the way, especially considering just how remote your surrounding was where you grew up. So if you're able to maybe talk about some of those influences in the early life that, really helped support your work.
I always was studious, did very well in school. I did have a counselor and actually a Spanish teacher that really kind of helped set this pathway for me. I don't think it's still available, but there is a scholarship funded by the Gates Foundation called the Gates Millennium Scholarship. And so I was one of the first few classes for that scholarship, and my Spanish teacher and counselor actually really pushed me to apply for the scholarship. It's not a full ride scholarship. I forget what the term they use, but basically they would pay anything outside of what financial aid would pay for.
Nice.
So basically I got my undergrad paid for, and a part of that scholarship, they paid for certain master programs and doctorate programs. And one of those degrees, and kind of not completely why I chose public health, but public health was one of those degrees that they paid for. So that kind of pushed me into the public health. But without that support of those teachers, I definitely wouldn't be where I'm at today, because I might have been hindered by my college choices and where I was going to go and how far I would go for my college career. I will say I definitely had some mentors during my master's and doctorate program. I actually got the job at Cherokee Nation because of one of my professors. And it's really kind of strange because I went to the University of Oklahoma for my undergrad, but then I went to the University of Kentucky in Lexington, Kentucky for my master's and my doctorate. So having a professor at the University of Kentucky who was familiar with American Indian Alaska Native populations and public health was probably unique. So, it was definitely kind of fate that I think brought that into. And she actually had come across a job opening at the Cherokee Nation Public Health Department for an epidemiologist. And even though I was not quite ready to graduate, she encouraged me to apply. And I didn't think I was qualified. And so I was like, oh, I'm not going to do this right now, even though this is something that would interest me. It would bring me back to Oklahoma, where I'm from. I wasn't quite confident in myself to apply. And so I don't want to say I ignored the email, but I just kind of disregarded it. And she took the initiative and actually emailed my former supervisor, Dr. David Gann, and said that I have this Cherokee woman who is working on her doctorate in public health, and I think she would be great for your program. And so that's what really kicked it off. So if it wasn't for her, I might not be where I'm at today, because I definitely did not have that self-confidence. So having mentors who really believe in you and will push you is really helps, especially if you might not have the confidence in yourself to really make that leap yourself.
What a story. Thanks for sharing that, and shout out to those two individuals you mentioned, your Spanish teacher and then this mentor who went as far as back as having to email the program on your behalf, because they know you so well that she's probably not going to make a move unless we make a move. And then here we are today. So that's really great to know. So I'm also curious to know about let's talk about your work, and because you also identify as someone who's part of the American Indian community. Can you tell us a little bit about, what that is like, especially for those who are not very, very familiar with that community? And because your work also centers around health disparities and what, a lot of your work also helps in shaping health outcomes, as it were. So maybe tell us a little bit about that population compared to the general population, what the most pressing health concerns are.
Okay, so just a little bit of information about American Indian Alaska Natives, because they are unique compared to other populations. Now, I'm not an expert on everything related to American Indians and Alaska Natives and how tribes work, but I can give a broad overview of what the differences are. So American Indian Alaska Native tribes are sovereign nations, meaning they are unique to federal and state. It's like their own country. So it's like the United States, and then you have like Mexico, but instead of Mexico, you have like Cherokee Nation or Navajo, and there's more than 500 federally recognized tribes in the United States.
Wow.
Within that, they have the right to govern themselves. So what happens within their reservation, they have a say so what happens. So a lot of times, if you have like state laws, the tribes don't necessarily fall underneath the laws within the state. Now, they do follow, federal laws, and typically they often follow state laws as well. And part of what makes American Indians and Alaska Natives unique is that they are the only population in the U.S. that has a guaranteed right to free access to healthcare. So part of the treaties that happened back in the day when all the tribes gave up land to the United States federal government. So in replacement of that land, the tribes received, basically the United States federal government is responsible for the health care of the American Indians, Alaska Natives at no personal cost to them. So that's, and it's been affirmed by Supreme Court cases, treaties, and congressional acts. And so with that, we have the Indian Health Services that supplies that healthcare and helps fund the healthcare, and it's a division within the United States federal government. And then some tribes, like the Cherokee Nation, they run their own healthcare system. They create a compact with the Indian Health Services so that they run their healthcare. Some of the smaller tribes, IHS runs the healthcare within their reservations, but Cherokee Nation has actually the largest tribal healthcare system in the United States. We have 9 clinics and 1 hospital. I think there's more than 100,000 people we see annually within the 14 counties in northeastern Oklahoma. And that's what I also say, if you're not familiar with Cherokee Nation, the reservation is kind of the northeastern part of Oklahoma, and it encompasses 14 counties. I will say, and I forgot to mention this earlier, just for everyone's information, a lot of the stuff that I'm going to discuss today are my own personal opinions, and doesn't necessarily reflect that of Cherokee Nation, and is not the official view of Cherokee Nation. So in regards to that, despite having access to healthcare or free access to healthcare, American Indians, Alaska Natives do still suffer from access to healthcare issues and other health disparities. They do have higher rates of cancer, COPD, heart disease, diabetes. And so there are barriers to access to healthcare, even though they have free access to healthcare.
Wow. Thank you so much for explaining that. That was very, very useful, and I appreciate that. So you've talked about just, the uniqueness of the population compared to that of the rest of the U.S. population. So what are some of the most pressing health concerns that you think we can highlight that are prevalent in those communities?
Yeah, so I do think that they do have the same morbidities and mortalities related diseases as the general population. There's that disparity. They just tend to suffer more from those diseases. So cancer, diabetes for sure is a big one among the communities. Tobacco related diseases, American Indian and Alaska Natives have higher prevalence of tobacco use in their populations. And so they do suffer from all of those related diseases. And with access to healthcare, one of the problems in relation to, even though they have free healthcare, one of the issues is just general distance from either the reservation or clinics. So a good significant portion of American Indian Alaska Natives actually don't live on the reservations. They live in urban areas. So part of the problems with some of the healthcare access is they're not close enough to the reservation, or they actually don't have to be close to their own tribal reservation, because you can receive healthcare within other tribal health systems, even though that's not the services that your tribe is providing. Does that make sense? Like if I was in Cherokee Nation, if you lived in Choctaw Nation Reservation, you were a Cherokee citizen, you could receive care from the Choctaw healthcare system. Yes.
So there's portability.
Yeah. So for eligibility for Cherokee Nation clinics is that you just have to be a citizen or a member of a federally recognized tribe. Okay. And so we serve a lot of tribes within our healthcare system. So you do have that transportation issue. Cherokee Nation has tried, and I think it has done a good job, at least for those who are living within the reservation. They have strategically placed their clinics so that everyone is within 30 miles of a IHS or Cherokee Nation clinic. So they're very strategic about that. But there are still gaps. There are people who, even We are doing a lot of hepatitis C, HIV, and syphilis screening within the communities. And so even though we're doing the screening, we can't treat out in the communities yet. We're working on it. But even people within Tahlequah, Oklahoma, where is the main capital of Cherokee Nation and the largest clinic within Cherokee Nation, they don't even have a card to make it to the clinic. So, I think meeting them where they're at is important. So having those mobile units to provide healthcare, doing community screening and testing within community centers, I think would also help. And I also believe that there are in relation to research, when we're doing research, of making sure that we're reaching all of Cherokee Nation. Part of the problem I have when I'm doing research within Cherokee Nation, it tends to be centered within one place within Cherokee Nation. So trying to capture what is happening all through the reservation is important, which is difficult because especially within Cherokee Nation, you have a lot of natives and non-natives living with there. So identifying places where natives are so that we can do the research to find the gaps and barriers to healthcare access, I think is one issue that we also need to address on the research side.
Okay. 30 miles to care, that sounds like a dream come true, but I love how you also highlighted that despite that, proximity, you still have some challenges in getting people access, or even people getting access to the care that they need. So you've talked about just the challenges, like some of the challenges to accessing healthcare. What are some of the challenges you think are prevalent in Native communities in participating in research, and how can we address them?
Okay, so that is good. I think part of it is really a big aspect, I think, among American Indians, and this probably is not unique to American Indians, but making sure that the community is involved in the research is really important, and understanding what the community is. The example I like to give, because tribal populations are often targeted for research, one, because of the health disparities that are seen among American Indian and Alaska Natives. And so sometimes we have academic institutions that want to come in, and I think there might be easy funding, right? So they might get funding easier for targeting this population that has high health disparities. And so they come in, do the research, and then leaving the population with no guidance on what to do next. So they've identified these barriers. What does the community do next? So making sure that the research is community engaged. Engagement with community is extremely important. Having local stakeholders and leaders is important, not just reaching out to the tribe itself, because I have had academic institutions reach out to me personally because they want that community stakeholder, that partnership and engagement, and then they think they're done with that community engagement. That my point of view is that of all of Cherokee Nation, and if they talk to me, then they've got the perspective of all of Cherokee Nation. Cherokee Nation is very diverse, and I know what it's like to grow up Cherokee in Rogers County. I don't know what it's like to be Cherokee in Adair County, and these two counties are vastly different. So expecting that I'm going to provide all the answers to the community engagement piece doesn't work, because I don't know what it's like. And so making sure you have those local leaders is really important, because individuals trust their community leaders more so than, other people who are outside of that community. And we definitely found that during COVID, when we would do surveys asking them about where do they get their information about COVID, who do they trust in relation to COVID information, in regards to testing, treatment, and vaccination. And it was their local leaders. And so making sure that they are included is important to make the work, to actually get it completed, and to make sure it's sustainable, because the community know what will work and what won't work in the communities. And without that engagement, the research won't go anywhere. You might get some papers published, you might get a little extra funding, but you're not going to actually make an impact on that community.
All right. Thank you so much. Much appreciated. Especially the importance of trust and working with the community leaders. And I think that's very critical, especially in communities. I do work with Black population, and I always have to balance the insider and the outsider piece of me. Even though I look Black, my experiences sometimes might be vastly different. Because, for example, I do work with men with prostate cancer. I'm not a male. I don't have a prostate, and so having to like make sure that I'm also in tune with what they want and working with the leaders there to gain the trust and dwell together and not like you're just doing that touch and go. I just want to use it for my research now. You're building community with them in every sense of that word. So for those who might be interested in maybe venturing, who might have a vested interest in working with, you know, Alaska Natives, American Indians, but they really don't know how to get started, especially maybe because they're not from that community, but they're very passionate about working from that community. What strategies are you able to share that have worked best in fostering those long-term meaningful partnerships and research?
Cherokee Nation is trying to expand the research that is done within the tribal government. We're working to expand that. And I do think partnerships with universities and academic institutions are going to be important because, especially now, as we expand and gain more expertise, I'm not an expert in every area of health research. And so a lot of times people will come in and say, we want to do this research project. And Cherokee Nation does like to, if they can, have someone within the Cherokee Nation healthcare system or government be a lead on that project, just so that we can have a say so. So definitely engaging the tribe and making sure that you're going through the appropriate approval process to do research. So, if they have an IRB, reaching out to their IRB is a good way to get started, because the IRB is going to know the process of doing research within that tribe. Sometimes they don't have a tribal institutional review board, but they may have another process that requires going through their council to get approval. So making sure you're going through the appropriate approval is really important, because there's no quicker way to have that partnership be ruined is by not respecting the sovereignty of these tribes. Because part of that sovereignty is they also have a right to have a say-so of what data is collected among their population and how that data is used and disseminated. So an example of Cherokee Nation is that our Institutional Review Board, or IRB, requires that all public dissemination materials be submitted to the IRB for approval. So for academic institutions, a lot of times, once you get the approval from the project, you don't submit your publications or your presentations to the IRB after the fact.
Yeah.
For tribal nations, particularly with Cherokee Nation, you have to submit that. So making sure, and it's just so, it's not that they're trying to dictate what is said about Cherokee Nation. They just want to make sure it's not going to harm the community, because it has happened before, that people have taken data and misconstrued it to that was actually harmful to the community. And so that's part of the Cherokee Nation's IRB authority, is to make sure that the data is being represented correctly, while acknowledging that American Indians do have health disparities, and there are some things that are, that gaps and barriers to healthcare or just health in general within Cherokee Nation.
Yeah. Okay. Thank you for that. And as a follow-up question, I think you alluded to it, but I wanted to just maybe get a fuller understanding of it. Data collection is a big component of research, right? And I imagine that this can be a sensitive issue in Native communities. How does one go about respecting those tribal sovereignty and ensuring that ethical approvals are done properly when conducting research within tribal jurisdictions?
Yeah, so what I would say with that is having the tribe kind of have ownership of that data is key. That is really important, at least at Cherokee Nation, that when a researcher comes in, they don't own the data, Cherokee Nation does. And I don't mean that they can't publish on that or analyze the data, but they have to know that anything that's done with that data has to receive approval from Cherokee Nation IRB. So an example of this is when, as in the United States, there's this movement towards submitting data to data repositories so that we can do additional analyses. Other researchers have access to that data to do additional analyses and publications from that and dissemination efforts. If you were to come into Cherokee Nation and had a grant that required submission to a data repository, you have to guarantee that that's not done without Cherokee Nation's permission, and it usually requires some sort of data use agreement or some sort of approval process for Cherokee Nation to have a say-so of what happens to that data once it is deposited into the data repository. And so having kind of the tribes have a say-so in what happens to that data is really, really important because of there's a lot of mistrust with American Indians and Alaska Natives when it comes to outside entities, including the U.S. federal government, because there has been things that have occurred that has caused trauma to the tribes. Yeah. And so, that term, was it a helicopter research where you just come in, take it and leave? At least for Cherokee Nation, part of our review process is how is this going to benefit Cherokee Nation and Cherokee Nation citizens? We don't want something that's going to change, help the community 20, 30 years down the line. We want to see kind of that immediate benefit and that how are we going to sustain this? Because if you show something, a lot of implementation science, research science is done. In Cherokee Nation, we want to say, hey, how can we sustain this? If we find out that this intervention or program works to improve the health, how are you going to help us make sure that this is sustained past the grant funding period? And I think that's really important, is making sure and establishing those relationships with the tribe, and just really making sure that they are leading the project, and it's not you as the researcher making those decisions without the input of the community and the tribe.
Well, I imagine that your work is kind of cut out for you, because when you talked about the immediate impact, when I think about implementation science, we know sometimes it takes up an average of 17 years to go from bedside to benchside, and even to the streets as well. But you just honing on the impact of how does this benefit Cherokee Nations? How do we sustain these interventions beyond the grant funding? That's a tough cookie to crack.
Yeah, and it's not to say Cherokee Nation doesn't care about the long-term research that might take years to get from the bench to practice. Yeah. But it can't just be that. And because we've talked a little bit about like genomic research and how that the biological samples that might be collected today might be beneficial for a new therapeutic or diagnostic tests. And so we're still currently working on developing those protocols and procedures of how does that type of long-term research look in a tribal population? Because again, there has been some, negative outcomes of research in tribal populations. And so trying to balance of not being left behind on research, but also making sure that the population that is being researched at this time is not being harmed by the research that is occurring.
Okay, that makes sense. Thank you. Thank you so much. So you've talked a little bit about, and during your bio, this came out, and you've mentioned that a little bit. So I would like for us maybe spend some time talking about this. You played a key role in the Cherokee Nation's COVID-19 response. What were the biggest lessons you learned from that experience? I can't even imagine it's been 5 years since then. And in talking about, the longevity or the life cycle of work done in that community post when the grant is done and all, how have the things you've learned from that experience been able to inform, future public health initiatives?
Yeah, so I was definitely heavily involved in the COVID response with Cherokee Nation. I will say there were some things that really benefited Cherokee Nation compared to some other populations. One, we did have our own public health department. So we had that kind of baseline structure. And actually, the Cherokee Nation Public Health Department was the first tribal public health department to be accredited by the Public Health Accreditation Board. And so with that, they gave us kind of the framework and the structure to respond to the COVID-19 pandemic. Of course, there were things that we had to expand rapidly because we weren't quite there yet in regards to like infectious disease response. But I will also say that tribal leadership really played a big role in our COVID-19 response. Having tribal leaders, healthcare leaders, and public health leaders that trusted the science and listened to the experts really helped with helping contain some of the impact of COVID-19. Our chief did stay-at-home orders, and for the first 3 months of the pandemic, a lot of the services, or I don't say services, but like people were working from home. We expanded greatly for telehealth, telework, so that we could social distance. Anytime there was a spike in COVID within Cherokee Nation, they mandated mask wearing. They supported vaccination efforts among the employees and the general public. So they offered testing and vaccination to natives and non-natives because they understood the importance of the fact that infectious diseases don't stop at the border. So non-natives getting COVID impacted the native population. And so they were really open to those type of public health activities. And I think that one positive impact of COVID-19 was really highlighting the importance of public health, especially and not to say that our tribal leaders didn't think public health was important before, but they definitely realized, I think it opened up the idea that health is just not in the clinics. So we definitely are, increasing, I believe there's a program increasing the number of sidewalks within Tahlequah, improving access to housing and food. And so we've come to understand that, healthcare or health is just not based on healthcare and access to healthcare, but it is those social determinants of health. And so I think that the one positive thing of COVID was that it really did highlight the importance of that and the need of that. And I really do think the tribal leaders have taken that and ran with it. And so I'm really hopeful that we'll see even a greater impact of our public health within Cherokee Nation, because we're addressing some of those social determinants of health. We're not just looking at healthcare as a way to improve health. We're looking at as a whole systematic, syndemic approach and making sure people have those basic needs that can really impact their health outcomes.
Wow, thanks. I love just how you ended up just highlighting again the co-creation process that goes between scientists and tribal leaders and working together for the good of the community. And, the input is not just one-sided, like you talked about in helicopter research, but you're all, working hand in hand to make sure that you're addressing these needs and assessing the effectiveness of it and also tailoring it to the needs of the community. Thank you. So what do you think the future looks like for research down the line with your population of interest?
So, I definitely am excited for what Cherokee Nation is planning on doing with research. I won't go into details because I don't...
Yeah, sure. You can't speak for it.
Yeah, so I don't know. Nothing's happened quite yet, but there are things in the works. But I really hope that we, I really appreciate implementation research science because there have been a lot of interventions that have been found to be effective in other populations. But given the unique nature of American Indians and Alaska Natives, particularly if we're looking at healthcare research, we have to take that into consideration because, for an example, a lot of times research involving healthcare will really focus in on insurance. And not to say that access or insurance status is not important in American Indian populations, because it is, because it does help create more revenue for the healthcare system if individuals have insurance. But it's not as a barrier to treatment and access to care in American Indian populations, because they just have to go to the tribal healthcare system, and they receive that regardless of insurance status. So I'm hopeful that we do more implementation science research to say, how do we adapt these interventions that have worked in other populations to our population? And so I am really excited for that type of research to go in to improve, cancer screenings and outcomes in relation to even, childhood vaccinations. We're seeing experience of measles outbreaks. And so making sure our populations are vaccinated for this, and how do we kind of adapt some of those interventions that have worked in other populations?
Thank you. Thank you so much. Sounds very exciting. So my follow-up question to that will be, with the rise of artificial, intelligence and big data in health research, do you think these technologies could help improve health outcomes in tribal communities? And what do you think are the biggest opportunities and risks?
Yeah, so I haven't, I don't know much about this topic. It's not something I've researched. It is interesting in that, as for me as an epidemiologist, I do a lot of data queries within our healthcare system. And so there are limitations to what data I can pull at an aggregate level, just by whether or not I can pull information from this field. So for an example, we have quote unquote notes in the electronic medical records. I can't pull that data from what the provider inputs into those notes. And so if AI could maybe search those notes to look for keywords, say I'm looking and really interested in tobacco use. We do have tobacco screening questions, but they're not as in-depth as I would like. But maybe the provider actually put in their notes that this person smokes 1 to 2 packs of cigarettes a day.
Yeah.
That would be good information to pull if I was looking at tobacco use prevalence or looking at any sort of research in relation to tobacco use. I would love for something to be able to pull that data, and so that we could get a more accurate view of the population and their health behaviors. But there's a lot of issues with AI in that, who owns that data?
Right.
Because you have to input the data into those systems in order for it to pool. And so, that creates the issues that I've stated already about data governance and data sovereignty and who has access to that. So I don't think, I think it's promising, but we have to put those safeguards up so that the data is protected, especially among this population.
Okay. I mean, so true about data sovereignty. And we've talked about just the importance of making sure that the data is owned and is owned by your community. So I imagine AI and its promises, while it also holds a lot of promises, the onus will be on how to even safeguard the safety as well of the data and the source of that data as well. For young native scientists, researchers and public health professionals looking to make an impact in their communities, what advice should you give to them?
So, I really think they should just go back to their communities. They're the ones to best do this work because they know their communities. So I would say, advocate for funding of research in public health and tribal communities. That includes advocating at all levels across tribal, state, federal funding. If your tribe doesn't have a research department or even a public health department, advocating for your tribe to develop those departments would be really great. But if you can't, or even going to your local, in Oklahoma, they have county health departments that are located within some of the tribal reservations, working at that level too. If you do end up working up for an academic institution, I would say making sure that your academic institution understands the uniqueness of American Indian populations, that they are sovereign nations, and making sure they are following and being respectful of the data that is collected among American Indians, because they themselves, as they are native, they're the best ones to advocate for that. So I think that really advocating for funding and then making sure people understand tribal sovereignty is really a good starting point for those individuals. And then, of course, always going back to your community.
Thank you for that. So, the OUHSA, which is the University of Oklahoma Health Sciences, was recently awarded the ICON grants, the $17 million ICON grant by the NIH, which was really to improve cancer outcomes in Native American communities. What are your thoughts on this initiative, and how do you see it shaping the future of native cancer research? Because I recall when you talked about some of the disparities you see, you talked about tobacco-related disparities, cancer disparities. So what are your thoughts on this initiative, and how do you see it shaping the future of cancer research in the Native American community?
Yeah, so I'm really excited about this project.
Right.
I've had family members who have battled lung cancer and other tobacco-related diseases, and so it's very personal to me to make sure that people are diagnosed earlier so that they have better survival. And so I think, this is the type of implementation research science that I really like, and I think would be beneficial for tribal settings. Again, part of that is the unique nature of the healthcare system within tribal settings. In America, like I said, American Indians have a right to healthcare, and their needs in relation to that is unique when compared to other populations. Lung cancer screenings that may work in a typical tribal setting may need to be adapted or tailored to an American Indian, Alaska Native tribal setting. And so I do hope this program increases lung cancer screening and early detection of cancer. But I also hope it encourages other tribes and tribal organizations to participate in research projects. So if this is found to be successful within Cherokee Nation, I'm hoping that this will have an impact outside of Cherokee Nation and other tribal settings, and maybe hopefully encourage other tribes to participate in research, because there is a hesitancy to participate in research projects. And when Cherokee Nation leads the way in research and shows that how this can benefit your population, I'm hoping that it'll be picked up by other tribal healthcare settings.
Yeah. Thanks. And we feel that excitement is very palpable. And the ICON grant stands for the Improving Cancer Outcomes in Native American Communities. And the NACHE, which is the Native American Center for Cancer Health Equity at OU Health Civic Cancer Center, led the work on this grant. So kudos to everyone whose work has been instrumental in securing this grant. Now, as we kind of draw the podcast to a close, I had some tying down questions. So you've talked about just how you grew up and the events that have shaped you, the mentoring, and even your career path as well. If you were to look back in time now and give some form of advice to your younger version as well, what would you tell yourself? Something you wish you had received earlier in your career or in your whole, let me say career, because this is a professional podcast. Yeah.
Okay. So what advice I would give myself is that public health is not always easy. It consists of small steps forward and then a couple steps back. It's definitely a marathon and not a sprint, and progress comes in waves. So don't be discouraged when it seems like nothing's occurring, because it also takes a long time to see progress. One of I think the easiest ways when you're looking at like obesity, year by year, it's really hard to see a downward trend just because it takes a long time to change that prevalence. And so definitely think of this as like, what do you want by the end of your career? What do you want to have accomplished? And don't assume that if it's not done within 5 years or even a few years that you're not making an impact. You are. It takes a long time to see that.
Thank you. I love that. It's a marathon, not a sprint. So you might wax and wane, but just keep going. Don't stop. Yeah.
Yes, because it is really exciting when you do see that change.
Right.
I will tell you, when I see, if we're looking at tobacco use and we see a significant drop in tobacco use, it's really exciting. And so just remember and hold on to those moments to keep you going through the times where it may not seem like you're doing anything, or the progress is not occurring, because it is.
Yeah. Okay. Thank you. Another question I'd like to ask you would be, related to maybe just some of your hobbies. So let's start with maybe a book or a podcast that has really profoundly shaped your work, or any form of media that you can recommend to our listeners.
Okay. I would say one of my favorite public health books is The Ghost Map by Stephen Johnson. It's really about the father of epidemiology, Jon Snow, not the Game of Thrones character, but the father of epidemiology, and how he really did take low-cost interventions to prevent, an outbreak of cholera, or to mitigate the problem of an outbreak of cholera. And it wasn't even, we didn't know much, or he didn't know much about germ theory or what was causing the cholera outbreak. And so we don't have to know everything about a public health issue to make an impact. And so, all he did was remove a pump handle to a water pump.
And then map the cholera spots across.
Yes. And how he used just basic counts of determining where that outbreak was. And so public health doesn't have to be sophisticated. You don't have to be technical. It can be small things like that make a big impact. And so it really kind of shows how public health got started, or epidemiology at least, and some of that impact. I will say some of the other books that I've enjoyed are, Demon in the Freezer and the Hot Zone by Richard Preston. If you like infectious diseases, I will say those books are a little bit scary in what could occur, but they are really interesting in public health aspect.
From the title alone, Demon in the Freezer, I'm like, ooh. So another question I had for you, what if you could instantly fix one major health disparities in your community, what would it be?
I mean, I'm going to have to say, if I could reduce all of tobacco use among American Indian populations, I would. I am one of very few people in my family that doesn't use tobacco. And I've seen firsthand of what it can do and how it can really reduce your life expectancy. And so, we've lost a lot of years with some really great elders. And if I could take that away from future generations, I would. So tobacco use is my number one thing. I wish I could just snap my fingers and everyone would stop using tobacco.
Yeah, and correct me if I'm wrong. I learned that because I do just minimal tobacco research. One of the reasons why it's so hard is because for some of your rites and rituals, you have tobacco as part of those components. So there's a spiritual component to it. Is that correct?
So some tribes do use tobacco in a ceremonial way, but it is vastly different than commercial tobacco. You don't have the same additives in tobacco products, and they're very specific on how they use it. And I will say that is another unique aspect of American Indian Alaska Natives. And I don't know if I said this earlier, but when you're like adapting or tailoring like data collection tools and making sure that the questions you're asking are relevant to the population. And often in American Indian Alaska Native research in relation to tobacco use, you do specify, do you use tobacco commercially, not in a spiritual way, so that we try to differentiate between commercial use and ceremonial use when trying to capture tobacco use data.
Thanks for adding that, because I didn't make that distinction of the type of tobacco being used and how, specifically it's being used. So I learned something new today. Thank you. I guess this is my final question. It's one of curiosity, and it's also born from just how you've been, just talking to you so far. I can definitely see how your heritage has impacted a lot of work you do. So I think just to get a little bit personal, if you're open to sharing, what does it mean to you to be Cherokee, and is there an aspect of your culture you would like that brings you the most joy or pride that you'd like to share with us?
So I just think the aspect of community is really strong. I have a sense of strong connection to the tribe because they were there at times that I needed when I was younger. So like, I know there was times when we used commodities or food commodities when we, were at times of economic distress. Or, I personally was, I was premature when I was born.
Mm.
And I spent 2 months in the NICU. And so my parents didn't have insurance. And so because we were a citizen and a tribal member, my parents weren't burdened with the cost of me being hospitalized for the first 2 months of my life. And I only say that it makes me want to give back to the Cherokee community, because I received that, and that aspect of receiving that support from the Cherokee community growing up has led me to where I'm at today. And so wanting to give back, and I think that all Cherokees have that sense of community and want to provide. And it's not just individuals. We're not just focused on ourselves. We want to give back to the whole community. Because, you're only as strong as the weakest of your community. And so uplifting those people who need it. And I think I'm proof of that community support helped me be to where I'm at. And without that support, I don't know if I'd be where I'm at. So I really appreciate that aspect of the Cherokee culture, and that sense of community and belonging to that community. Definitely is where I think I appreciate.
That was beautiful. That was beautiful. Thank you so much for sharing that. I think it speaks to your heart of wanting to give back, because you've been given so much, right? And I appreciate that response you gave. Now, as we close, we have something on the podcast we do where we have the last guest leave a question for the next guest. They don't know who the next guest is going to be. I don't even know who the next guest is going to be. So you answer your question, and then you leave a question for the next guest. Is that okay? So I have 6 questions because I've had like multiple guests. But if you can choose from number 1 to 6, and I'll just ask you one question.
Okay.
So, one number, 1 to 6, choose a number.
Okay. Oh, just pick a random number?
Pick a random number from 1 to 6, because I have 6 questions. I don't want to ask you all 6 questions,
Let's say, let's go with 4.
Oh, I was hoping you were going to say that. What's one new goal you've set for this year that is different from the other goals you've ever set for yourself in previous years?
Just like a personal or work, or does it?
Whatever you're comfortable answering. And this is from Megan Wright, one of the DNP students who came on the podcast with Dr. Dresser.
Okay, let's see. One goal.
Yeah, one goal, yeah.
Oh, gosh. Well, I think a personal goal, I guess, would be that I would like to engage organizations in the community to further expand what we're doing in regards to our community screening of hepatitis C, HIV, and syphilis. We've done a really great job in Tahlequah of providing community screening at one site. And I think it's been so beneficial because this is a population that is high risk for those infectious diseases because they, are often have addictions and, IV drug use, which is a high risk for that. So expanding that we're reaching other populations, I really have to give credit to our infectious disease clinic and staff because they really know how to connect with these individuals who are often overlooked and sometimes disregarded. And so expanding that would be a really great goal this year so that we can reach other populations outside of Cherokee County and, make a big impact on HIV, hepatitis C, and syphilis rates.
And on a personal level, and thanks for sharing that, by the way. On a personal level, is there a goal you have that you like to share? Yeah.
On a personal level, I'll say I want to improve my physical activity. I have an office job where I work remotely, so I have to be conscious about how long I'm sitting in my chair because I don't even have the water cooler talks with coworkers. I have to make sure I get up and walk around or, not sit in my chair for 8 hours. So becoming more physically active, because I find it sometimes when I'm working an office job, you don't get too many steps in. So my goal is to get a little bit more exercise in so that, I continue my own personal health journey, so that I'm, was it practice what I preach?
Yes,
so
yes.
When I'm telling people to eat
Not
healthy,
physically
exercise.
active, yeah.
So make sure I'm being honest with myself when I'm telling other people to be physically active. I'm also doing that.
Thank you for sharing that. So lastly, what question would you like to leave for, and I wish you all the very best with the two goals you've shared. What question would you like to leave for the next guest?
Let's see. I would say, what is their favorite part about working in public health? Like what brings them joy in the work that they do?
Okay. Thank you for that. I have noted that. And those were all of my questions. It's just been really lovely talking to you and, hearing about your work and the passions. And I think in doing over 20 episodes so far on this podcast, it's always amazing to really talk about, get the podcast started by talking about the foundational stuff. Like you always see, those pivotal moments in people's childhood, like, the way you, for example, the way you grew up and the agents that played those roles in shaping, your giving back to the community through addressing, public health issues. I just want to say thank you for joining us today and so generously sharing your knowledge, your lived experiences, and also your deep commitment to really advancing health equity in Native communities. I think your leadership is powerful. It's a powerful reminder that when we do research that is rooted in trust, in culture, in community, and dwelling with those communities that we're passionate about, we can truly change lives. And to our listeners, thank you so much for tuning into this important conversation. Until next time, stay curious and stay committed to your communities, and let's keep reading those research with impact and trust. Thank you, Dr. Comiford, and I hope to bring you back again in the nearest future. We can maybe expand more of your work, but I hope this was